our next speaker is Sailesh Konda. Sailesh? Sailesh, I think you're mute.
I'm a dermatologist in Most at the University of Florida. I've lectured extensively on private equity and dermatology and researched as well. Dermatologists from all over share with me their disconcerting experiences with these groups. However, many of them are shackled by non-disparagement agreements and are afraid to speak publicly. Dermatology has experienced a tidal wave of consolidation over the last decade. Influential leaders in dermatology are selectively recruited by these groups in order to minimize scrutiny. There have been at least 38 regional PE-backed derm groups, 4 which are now defunct. Furthermore, 10 of the largest have formed a trade coalition, which controls approximately 70% of the PE-backed dermatology space. We're now entering a phase of regional mega mergers, and in some metro areas, consolidation is limited both choice for patients and insurers. Publications have documented a largely negative impact in DOP ownership, and surveyed physicians state these groups worsen quality of patient care and physician autonomy. Our research found some PE firms that were not performing due diligence and were employing outliers in intralesional injections performed on nursing home patients, where 75% had a diagnosis of Alzheimer's disease. Some have also acquired outliers in skin biopsies when consolidating practices. Additionally, research has shown these groups over-leverage non-physician practitioners with varying degrees of supervision, which generates larger corporate profits. The mainstream media has documented these issues, including inadequate or faulty supplies in these groups. Unfortunately, these groups are not legally obligated to disclose PE ownership to patients. Public health experts have asked legislatures for transparency and a moratorium on PE investment in dermatology. Lastly, debt valuations of these groups have decreased and many remain discounted and below pre-pandemic levels, which means some may cease to meet their debt obligations. They will have to further increase revenue and cut costs to service large debt loads, which could further impact patient care. Meanwhile, many of these large groups tend to be small businesses, have secured over $26 million in forgivable SBA PPP loans. We hope the FTC and DOJ will also serve the best interests of patients first. The government's proposed guardrails for PE-backed nursing homes, and we now need similar vigilance for all of medicine. Thank you for the opportunity to speak to all of you today.